Hi, and welcome back to the Healing and Wisdom channel. I'm Dr. Crystal Nix, and this is Sean. We're so glad Sean's here with us today.
So am I. Thank you for having me.
Oh yeah, definitely. So we're going to be working with Sean, and first we'll just go over what he's dealing with and then do some treatments. So, all right, Sean, go ahead and tell us what you want to focus on today, what you've been dealing with.
It's just simply two things. It's just
Okay.
My wrist feels sore.
Okay.
There's something going on. I think I just over-exercised it
Okay.
a bit much. And then recently I seem to have strained my lower back, kind of doing an upper press movement
Okay.
with probably poor form
Okay.
yesterday. So if you could
Awesome.
fix me up,
Yeah, by all means.
that'd be great.
So, and for wrists, it's just the left one, is that right? Okay.
Yeah, it seems to be a slightly chronic thing that's bothered me on and off for years.
Okay, okay, good to know. All right, well, you're in good hands because Dr. Dayton, he's got more of the extremity background, so he's going to take care of you there.
Yeah, he's fabulous.
Yeah, and then we'll do, and then he'll actually also work on the low back in terms of adjustments. Then we'll get to do more of the acupuncture together. All right?
Sounds good.
Awesome. Okay, we'll get started.
Okay, so we're going to be working with Sean today on your back and wrist. We've worked with Sean before to help his wrist. He's had some different complications, but tell us what you're dealing with so that they can understand a little bit.
I think I just overexerted it, putting maybe too much weight when I was working out, and so I feel like I've strained it, and it doesn't feel as fluid, the up and down motion anymore. And sometimes it kind of like cracks,
Okay.
which is rare, but it happens once or twice a day. So
Okay.
I don't know what you can do with that. And also the lower back, again, I hurt using improper form, and so now it's just extremely sore. I feel like I have slightly limited mobility.
Okay. So today what we're going to check with Sean is we're going to see how the muscles in his hand are firing or contracting, and that will tell us a little bit of information about how the joints in his wrist might need to move. And so we're going to be testing that, and then we'll also test some muscles in his back to do the same thing. So Sean, you know, we always have you come over here, so I'm going to have you go face up for me, sit down there. Not sit down, but lie down. Perfect. And we're going to come on over here. That's a little high for you. Sorry.
Sorry.
Drop that down. You okay?
Yeah, I'm good.
Okay, cool. Alright, so here we go. First thing I'm going to do is I'm going to check and see what the muscles in his back are firing like. So why don't you push this leg up towards the ceiling for me, okay?
Mhm.
Hold that, I'm going to push down, you push up towards the ceiling, okay? Hold. Hold. Okay, relax. Push towards my hand. Push towards my hand. Okay, relax. Which side of your back hurts?
Right, lower right.
Okay, alright. Relax this leg. Let's go ahead and come like this. Bring this leg up. I'm going to push down. You push up. One more. One more. Okay, relax. Push towards my hand. Push back towards me. Any of those hurt when we did that? Sorry.
Not really.
Okay, cool. So like right in there?
Yeah.
Or a little bit lower still?
It's right about there.
More in there?
Yeah, exactly.
Okay, SI joint. So Sean's got the right SI joint that seems to be aggravated. So we're going to check his leg length, see how that is. But I also see a little bit of discrepancy when he's pushing his leg up. This is testing your gluteus maximus. Can you go ahead and push this leg up towards the ceiling? Push that. Push. Okay, relax that. And then we'll compare it with this one. Raise this leg up. So can you tell the difference there, Sean?
Yep,
Yeah.
sure.
So this glute on this right side isn't contracting the same way as the one on the left. So what we're going to do is we're going to stimulate some nerves back here. L4, L5 help contract that glute. And so I'm going to be stimulating by adjusting back here. And then I'm also going to check and see what how his pelvis is moving. Relax here, Sean. Okay. So raise this leg up again. Does that hurt when I do that in that area? No problems?
Nope.
Okay. Relax that. Does that hurt at all?
Nope.
Okay. Can you raise your leg? I'm going to push right here, and you just raise this leg up with the knee straight, okay?
Okay.
Go ahead and push up. Okay? And then go the other way. Okay. Okay, cool. Relax that. So I'm going to adjust a couple of things. I'm going to adjust right here, your ilium and your sacrum. And what I'm doing when Sean does that raised leg, I'm pushing here on his sacrum and seeing if there's any discrepancy between the way that the legs are raising. And it looks to me like it's a little bit easier for him to raise his left leg than his right leg. So we're going to try and see if we can help correct some things there. So Sean, I'm going to first, you've been on this table before, but for people who don't know, in YouTube land, we've got, this is called a drop table. I'm going to be pushing here, and this will drop below him, beneath him.
Gotcha.
And that's going to help so we can actually help the joint to move without me having to put as much pressure or force into you.
Sounds good.
Sound okay? Cool.
Yes, sir.
So I'm going to start up here. This is his L4 vertebra and L5 vertebra right there. And I'm going to be pushing down right now. You okay?
Yeah.
Okay. And then I'm going to come down here to his ilium. Is that okay?
Yep.
Is that tender?
No, it's okay.
Not bad? Okay, good. I'm going to come like this, and I'm going to be rotating this way. To try and see if we can get his sacrum to rotate a little bit. You okay?
Yes.
Okay, cool. That looks really good. Cool. Go ahead and raise this leg up towards the ceiling, Sean. Hold there. I'm going to push down, push up. Perfect. Relax that. Raise this leg up. Hold. Okay, relax. Perfect. Okay, so we're going to do a little bit of this just to work out some of the muscles in the area. So what we've just done is we've adjusted the right ilium. You have 3 bones in your pelvis. You have the 2 ilii, which kind of wrap around your body like this. And in the back, in between the two, you have this triangle-shaped bone that's right in between your 2 ilii. And that is called your sacrum. And we worked on basically 5 different bones. L4, L5, sacrum, and then the ilium today. And after we adjusted his lumbar spine, his right leg, Sean, did it seem like your right leg was a little bit easier to contract and keep up after that?
Yeah, definitely.
So we stimulated those lower lumbar nerves that allow the glute on that side to fire a little bit better. And that just gives us information to say, yes, that was the correct place that we needed to adjust, and yes, we can actually get those nerves to give proper stimulus to the muscle so that he's more symmetrical the way that he's moving after that. Okay, all right, Sean, why don't you come on up? I'm going to work on your wrist.
Okay.
So come on, I'm actually going to, let's see, it's your left wrist, so let's come on over here.
Okay.
And what I'm going to do, actually, can you stand up a little bit easier for me? So I'm going to just check and see if that aggravate you
No.
when you do that.
I did feel like a little pop.
I felt
almost,
that pop. Yep. No pain when you do either of those?
Okay. No.
Any pain on that?
Mm.
No pain on that?
No.
Okay. And, okay, we're good? Okay.
Mm-hmm.
Come like this for me. Yep. I'm going to have you hold your pinky there. I'm going to pull out. You pull in towards the middle. Okay.
Okay.
Hold. Okay. And then come like this. Hold. Okay. And then rotate over like this. Hold again. Hold. And instead of tucking your pinky, I want you to put pad to pad. Okay. And then rotate one more time. Back over.
Oh, okay. I thought I was fighting.
Keep that hold. No, that feels good. So, usually we would adjust you. but that's actually holding really strong, which means that the nerves are properly firing. That can be one of the things that can be impeded, is the nerves cannot be firing properly to keep these muscles that allow you to do that motion which is controlled by the median nerve.
Okay.
You actually don't have that going on. So we're instead of doing adjustments, we're actually probably going to do more ultrasound
Okay.
to see if we can calm this down.
Sounds good.
Because that's going to be a better treatment for you than doing adjusting today.
Okay.
That's not always true, but because that shows strong, we leave it alone
Okay.
and we do some ultrasound. So
Sounds
let's head on in there. Is that cool?
Yes.
All right, let's go. So we're going to be doing some ultrasound now. And what we're going to do, ultrasound, there's a lot of question about when people ask me, why are we doing an ultrasound? And I always tell them if they have something like a wrist injury or a knee injury, that we have to see if there's a baby in your wrist first. So that's why we're doing an ultrasound, which isn't true. There's diagnostic ultrasound and therapeutic ultrasound, and this is therapeutic ultrasound. Diagnostic ultrasound would be used to look inside someone for a baby. Sean doesn't have a baby, but you can also use diagnostic ultrasound to see if things are torn or damaged also. We're not going to be doing that with Sean today. We're going to be doing therapeutic ultrasound. So it's using the same type of technology where this is emitting a sound wave, and that sound wave goes into the skin and the muscles and ligaments and tendons. And when it goes in there, it causes some friction. And the friction causes some heat. And so it's like a deep heating modality that helps to calm those different structures that we're trying to focus on. So for you, most likely, when you're saying that it feels like you strain it when you're putting some weight on it, most likely it's a tendon that's become a little bit aggravated. So this helps to calm it down.
Great.
Since we don't have any joints that we need to necessarily move, we are just going to do the ultrasound, and then we're going to follow up with acupuncture from Dr. Nix so that she can help focus in, laser in on that, and make sure that it gets feeling better. Cool?
Sounds good.
So, for those of you who haven't had a sonogram, we're going to use some gel like this. This is called conducting gel, and the conducting gel, just make sure there's a nice, good seal between the head of the ultrasound and the person's skin. So we just come like this, and I'm going to come like this, and we're just going to kind of go through the parts. Show me where it hurts the most, Sean.
Probably right in there.
Okay, all right. So we're going to hone in on that. Now, it should feel warm to him in just a little while. Sometimes it takes a little bit. And at first, obviously it's going to be cold because of the gel, but it will warm up here in just a little bit. And if you don't feel anything warm, I'm going to change the settings just a little bit until we do feel that warmth.
Okay.
Now, ultrasound shouldn't feel sharp. It shouldn't hurt. Those sound waves can create agitation, and we don't want that. And sometimes you'll feel a sharp feeling if you feel that, or if it feels too hot, you let me know.
Okay, we'll do.
If you don't feel anything, you also let me know. So,
Okay. Yeah, I feel it getting warmer.
does it feel warmer? Okay, cool. I'll just kind of go through there. Cool. And many times we use ultrasound as in conjunction with our other therapies. So even if we if we need to adjust, oftentimes we'll use this, or we'll use a cold laser, and we'll use those to help heal the tissues that we've helped to recorrect on their in the right position when we've adjusted them.
Okay.
So, because oftentimes there have been things that have been stretched, like little ligaments have gotten little tiny tears, and so they need a little bit of a break.
Okay, that makes sense.
It's a little R&R time for those tendons and ligaments.